this is a pretty short chapter, but we're going to talk about stress responses and stress management. There's been different theories as to how we respond to stress. And Walter Cannon came up with this idea of fight or flight, right? We know that's that sympathetic nervous system that kicks in and your blood gets shunted to your vital organs. Peristalsis slows down. Your pupils dilate. It was that response of fight or flight. And what we need to think about is think how you feel. This is how we were supposed to feel if a lion was attacking you. However, people who suffer from anxiety, their body is constantly going into this, and it is incredibly stressful, physically draining and stressful on the body. So anyone who suffers from anxiety, it makes sense why people are so tired. It makes sense why people want to sleep a lot. It makes sense why people are zoned out when they're anxious. It's because your body is in this fight or flight. And an idea that sort of goes along with that is this gas theory of anxiety, and you definitely want to know this. And it's very similar to fight or flight, but it said at first you have that alarm, and that's kind of that fight or flight, and then you resist it, and then you're exhausted. And it's really this sort of way that we deal with stress. And so gas, I want you to make sure you know that gas theory. And so hopefully eventually you exhaust and get rid of the stress, but if it kind of keeps resurfacing, you keep going back through this stage. And you can have good stress or bad stress, right? Distress is bad, it's draining, and eustress is good, and it can definitely be motivating. Well, think about a vacation, right? It can be stressful to get ready for a vacation. However, it's a good thing. But we also know some people have a hard time even adjusting to good stress. There's some people a vacation just puts way too much anxiety on them. So even good things can cause negative types of stress. It's very, very individual. We know that stress can have a response on our serotonin ability and our brain's ability to use serotonin, which is why the SSRIs are big medications that are often used for anxiety, because that helps the body to reuptake more serotonin. We know that when people are stressed, especially during that alarm phase, it's that fight or flight, that it can really have effect on people's immune systems, and that to have your body in that constant phase, we know can make people more apt to sickness, and then you just kind of get in this vicious cycle. So all different kinds of things can help people respond to stress, and we're going to talk a lot about this in class today. It's going to be very individualized. Maybe going to church for one person would relieve their stress, but for someone else, that would not do it at all for them. Some people, like physical exercise. Some people want to read. And so what's important with patients is to help them identify what works and what helps them to not feel stressed. And so, some things we can do is look at, there's different questionnaires. We always talk about using validated tools to assess patients, and there's validated tools to assess stress. And here are some examples. They say some of the biggest life stressors are divorce, death, right? And moving. Those are three really big ones. There's been a lot of research in stress, and there's just a lot of information out there. So it's kind of interesting. You can find quite a few articles out there. So our goal is to help people find healthy ways of managing their stress instead of unhealthy ways like binge drinking or drugs or inappropriate behavior or lashing out, right? Or throwing things or, all those kinds of things that could be inappropriate. These are different ways that people use to help their bodies to relax if they're feeling panicky or having a panic attack. Some people suffer from panic attacks and anxiety when there's no, they're not sure even what triggered it. And that's when a lot of this deep breathing can help. That idea of belly breathing, so in through your nose, out through your mouth, is huge. That is, I don't know if I've ever worked a shift in labor and delivery that I haven't said to whether the patient or their husband or the mother who might be with their daughter, look at me, take a deep breath in. When you are feeling anxious, we know through research that slow, deep breathing will help you to relax. It will release chemicals that will help your body to relax. We know that through evidence based research. So if you take anything away from this, always stop and take a deep breath. Or if you see someone panicking, having a panic attack, starting to feel stressful, look at them and say, look at me. Sometimes they just need to look at you and mirror what you're doing. All different things people do. Humor. I use humor a lot for stress. I've never been a big journaler, but I know some people really like that because they can see patterns in their behavior. Cognitive reframing, looking at something different. Man, I flunked that test, I'm terrible, versus, well, I flunked that test, I'm going to look and see what I can do better, and this is just a big learning lesson for me, and it's going to help me do better on my next test. That's that cognitive behavioral therapy, teaching people how you can reframe stressful situations in their brain. It is a very helpful tool and technique. Takes a little practice to get good at that. And exercise, we all know about that. So that's it. That's it for stress. We'll talk in more detail tomorrow.